Doctors Idries Abdur-Rahman and Jamil Abdur-Rahman. Doctors, good morning. Great to see both of you.
Good morning.
Good
How are
morning.
you?
Good to see
I'm
you.
great, better now with both of you. Dr. I'll start with you. We had you on a few weeks ago, both of you, right after Kennedy's nomination. Both of you were hopeful, you were positive about his leadership. So Dr. He's proposed a number of changes. What do you want him to tackle first?
You know, I would say without a doubt, food safety needs to be the number one thing that he addresses. The United States is one of few nations in the world that has as many food additives that we have, as well as the excessive amount of processed foods. Processed foods are linked to obesity, cancer, heart disease, heart attack, stroke, all kinds of horrible things. And so are the food additives. We've got over 10,000 food additives. So without a doubt, that is the number one thing that he needs to attack, in my humble opinion.
Yeah, especially when we compare ingredients to other countries. Dr. J, same question for you.
Yeah, I mean, he stole my thunder with that one, I have to say. I mean, the reality is that, food additives and processed foods make up, or I should say processed foods make up about 60% of the American diet, right? When you look at the food additives and the processed foods, you see these skyrocketing obesity rates. I think people are surprised to realize that obesity isn't just an issue of how you look and how you feel. It is truly a health issue. 50% of cancers in women results from either dietary indiscretions or obesity. In men, 25%. So this is the, an ounce of prevention is worth a pound of cure, drum that you have to beat continuously. I think that if we can address obesity and food-related illnesses, we will be a much healthier country. So that is the first place to start, 100%.
Yeah, especially when you lay out the numbers of women and men that get sick because of these additives. Dr. Let's talk about that measles outbreak in Texas. It's increased to 48 cases, making it one of the largest outbreaks in the state's history. Secretary Kennedy, he has questioned the safety of the vaccines in the past. Do you think we will see more outbreaks like measles, especially with RFK as health secretary moving forward?
Unfortunately, I do because, measles and these various viruses are like humans. We like to get on planes, pack our bags, and travel, right? And so it's not just in Texas right now. It's also been seen in New Mexico as well. And the thing is, measles is increasing worldwide, not just here in the United States, because folks aren't either being vaccinated at all or they're not being vaccinated completely. And one of the jobs of health departments, be it national, local, or the state level, is to educate folks and to provide access to care. And so I do have some concerns with RFK as Secretary of HHS that we're going to see more vaccine preventable illnesses, unfortunately.
Dr. J, staying on the topic of vaccines, rates are decreasing among children. So if parents are concerned about vaccines, what should they be asking their doctors?
Well, so that's one thing that I actually like about RFK's stance. When it comes to RFK's stance and vaccines, a lot of people think he's an anti-vaxxer. From what I've seen, he's really not. He said he's vaccinated, his family's vaccinated. What he wants is for there to be more transparency when it comes to pros and cons, risks and benefits of vaccines. And so I think that putting that information out there isn't necessarily a bad thing. I think that ultimately what parents need to ask their provider and ask themselves is, are the benefits of the vaccine greater than the potential risks of the vaccine? When you look at something like measles, for the most part, most people who get measles are going to be okay. They may have a rough week, they may have a rough 2 weeks, but they're going to be okay. There aren't many long-term sequelae that come from measles. And so I think the question when it comes to vaccinations is the question that you should be asking your doctor about any treatment. What are the risks? What are the benefits? And then you have to kind of make a calculation for yourself.
Dr. Let's move on to nut allergies. There's a new study. It says children may be able to develop a tolerance, eventually even overcome the allergy. This is a complete turnaround from when I was growing up. Can you tell me more about this?
Well, so there was a study that actually looked at exposing people, but the key here is with non-severe peanut allergies, trying to desensitize them over time. And so they basically exposed them to peanut proteins in progressively larger amounts and actually to peanut butter as well. And what they found was that these people over time actually did beat their peanut allergy, and even beyond the point of being sensitized, when the study was over, they're still able to not be allergic to peanuts. But the key is that these are people that are non-severe. So there's hope out there, but this is something you need to do with an allergist under medical supervision, and it's not for everybody.
Dr. J, I'm going to end with a different topic about a superfood that a lot of us didn't know was a superfood, yogurt. There's a new study. It says it may reduce the risk of colon cancer. Why is that?
Also, yogurt is full of probiotics, right? So we hear about probiotics all of the time, and probiotics are basically these good bacteria that keep your gut healthy. The gut health is basically body health. And so what they found in the study was proximal colon cancers, which are colon cancers on the right side, which tend to be more aggressive and tougher to detect. You can decrease your risk of proximal colon cancers if you have at least 2 servings of yogurt a day. Basically, the yogurt increases the number of the good bacteria in the gut. It makes the gut less what we call leaky. Less leaking means that there's less gut inflammation. Less gut inflammation means less gut damage. Less gut damage means less gut cancer. And so they basically say 2 helpings of yogurt a week can increase or decrease the risk of colon cancer. But it's not just colon cancer. Probiotics increase overall health, less dementia, less hypertension, less diabetes, less obesity, less depression. And so 2 servings of yogurt a day will keep the doctor away.
Oh, all right. I mean, I don't want to keep both of you away, but I will be eating my yogurt. Dr. Idries and Jamil Abdur-Rahman, always a pleasure, guys. Thank you. Thanks for watching. Go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.